Hello everyone. So today let's talk about the triple assessment. Triple assessment is done for women with symptomatic breast disease. So it includes three modalities, that is clinical, imaging and pathology. So under clinical we have two aspects, that is history taking and clinical examination. Under imaging we have ultrasonography and mammography, and under pathology we have core biopsy of the breast tissue. So with these three modalities, we can make a confident diagnosis in about 99.9% cases. So that's quite impressive. Okay, so first we shall begin with history taking. So in history taking, we need to take a detailed history of every complaint the patient mentions, but the main things we need to ask for are about the lump, the duration of lump, the rate of growth of lump, whether it is growing rapidly or it's growing slowly, whether it is associated with pain or it is painless, the number of lump, whether it is single or multiple. Then about the nipple discharge, we need to ask about the color, whether it is serous or serosanguinous or bloody or it is milky, and the duration of the nipple discharge, whether it is the discharge is spontaneous or only on pressure, whether it is from single or multiple ducts. And other history, we need to ask about the use of oral contraceptive pills or hormone replacement therapy, any associated medical conditions and drug history, whether the patient is taking aspirin or any other antiplatelet drugs, because we need to stop aspirin or other antiplatelet drugs before taking core biopsy. Other history includes obstetric history, menstrual history, the pain, the mastalgia may be cyclical and associated with the menstruation. It may be physiological. So other history includes history of previous breast disease or any breast surgery, or family history of breast cancer or ovarian cancer, etc. Now, under clinical examination, we need to perform inspection and palpation. Inspection we do in sitting position. We can remember it by seeing, that means sitting, S for S. And we have to do it in two positions, that is hands by the side and hands raised above the head. So by keeping hands by the side, we should look for any asymmetry, any skin changes, any prominent veins, any dimpling or puckering of the breast or the nipple, any the color of the nipple and areola, the size and position of the nipple areola complex, the direction of the nipple, whether it is pointing forward or it is pointing sideways, whether there is any inversion of the nipple. And by raising the hands above the head, we need to look for any dimpling or puckering when the arm is raised above the head, and we need to look for nipple retraction, whether it is retracted while raising the arms above the head. So in inspection we need to look for all of these, and in palpation we do it in supine position, so feeling for flat. So we can remember by this. There are different search patterns we can use for palpations. These four are the most commonly used search patterns. So first one is the dial of a clock. So we can palpate according to the dial of a clock, like in 12 o'clock, then 3 o'clock, then 6 o'clock, then 9 o'clock, in this way. Another method is the vertical strip method. So we can go from lateral to medial side, or we can go from medial to lateral side, any way we want. Similarly in another breast as well. In concentric method, we can go from center to the periphery or from the periphery to the center. So this is concentric method. And another is quadrant method. So we can palpate quadrant wise, upper outer quadrant, upper inner quadrant, lower outer quadrant, lower inner quadrant. And one thing we should remember is that the upper outer quadrant is the most common site for any breast disease, because this upper outer quadrant, it contains maximum number of the terminal duct lobular unit. So terminal duct lobular unit, it is significant because this is the most hormone sensitive part of the breast, and the maximum number of the terminal duct lobular unit is present in the upper outer quadrant. So this is important thing to remember. Now we have various techniques for movement of the finger while palpating. So the most common method is rubbing or circular method. So we use the pad of the three fingers. With the pad of the three fingers we move in the circular direction. So there we can apply intermittent pressure to find out the abnormality of the breast parenchyma, and we can apply deep pressure to find out the any abnormality of the chest wall. So these are the techniques of finger movement, and at the end we should not forget to palpate the lateral aspect of the breast as well by requesting the patient to roll over to the opposite side. So that is an important aspect we should not forget. So this was about the clinical examination of the breast. Now let's talk about the two imaging modalities, that is mammography and ultrasound. So mammography, it is the first line investigation, and it's also used as a initial screening tool in population based programs, that is mass screening campaigns. We can use mammography, and it is taken by placing the breast in direct contact with the ultra sensitive film and exposing it to low voltage high amperage x-rays. So standard screening mammography, it is performed in two projections, that is the craniocaudal projection and the mediolateral oblique projection. So these are the two standard projections used, and mammography is especially useful for women more than 40 years with less dense breast tissue. So less dense breast tissue and with more fat contents, they are more sensitive to mammography, and the mammograms are easier to interpret in such patients. In patients less than 40 year patient with dense breast, so dense breast, less than 40-year patient, mammograms are difficult to interpret, and ultrasound, it is more sensitive in those patients. So ultrasound, it can distinguish solid from cystic lesions. So if a simple cyst is diagnosed, then no further workup is needed. If the cyst is painful, then we can perform therapeutic aspiration under ultrasound guidance. If the lesion is well circumscribed, mobile and solid in a young woman, that signifies fibroadenoma. So regular follow-up using imaging is performed in those patients. And if the lesion is solid with irregular shape and ill-defined margins, then that is quite suspicious of malignancy, and it requires core biopsy. So we interpret this ultrasound and mammography findings in terms of BI-RADS. So BI-RADS refers to breast imaging, reporting and data system. So this applies to mammography, ultrasound as well as the MRI. So we can interpret all of these imaging modalities in terms of BI-RADS scoring. So there are 6 categories of BI-RADS, and category 4 and 5, they are suspicious of malignancy and biopsy is needed in these cases. So category 0 means the imaging is incomplete and we need to perform additional imaging, or we need to perform examination, prior clinical examination. Category 1 means the negative, and that is 0% chances of malignancy. Category 2 refers to benign, and that also has 0% chances of going into malignancy. Category 3 is probably benign, so it has more than 0% chance but less than 2% chance of being malignant. Category 4 is suspicious of malignancy and we need to perform biopsy. And category 5 is highly suggestive of malignancy, around 95% chances of being malignant. And category 6 is known biopsy proven malignancy. So this is about BI-RADS scoring. And at last we have core biopsy. So while taking core biopsy, we obtain the tissue under local anesthesia using a large diameter core biopsy needle device, and we use 14 gauge needle for breast tissue and 18 gauge needle for axillary nodes. So we do core biopsy under ultrasonography or mammogram or MRI guidance. So yeah, this was about the triple assessment of breast. So I hope you learned something from this video. Thank you for watching and see you in the next one.